All right. Well, coronavirus is not the only difficult medical diagnosis that a lot of people are dealing with right now. For example, cancer. It's not stopping because of the ongoing pandemic. Jill Canales survived a very aggressive form of breast cancer. She joins us live this morning with a message about taking charge of your health, especially during this difficult and uncertain time. Jill, good morning.
Good morning. Thank you for having me.
Thank you for joining us. Yeah, absolutely. Thank you. But we do know that, a lot of the routine mammograms and those screenings are being postponed right now because of coronavirus. I want to ask you, how important is it now that people pay attention to their health more than ever, and how can they find help?
Well, I agree with you. Most of what's being reported is that routine types of exams, including mammograms and maybe even GYN checkups, are being postponed. And from my own personal experience, I was diagnosed with, as you said, a very aggressive triple-negative breast cancer 10 years ago. And it was really found through my routine exams, through my routine exam with my OBGYN and then onto a mammogram. And my fear during this epidemic is that, as you stated in the very beginning, cancer is not pausing for COVID. It's obviously very important to stay healthy during this time, to practice social distancing, but things like screening mammograms, screening ultrasounds, if done in a freestanding facility in a low-risk situation where CDC guidelines are being advised, then I just hope that women, spend extra attention paying attention to their overall health.
Yeah, I've heard some people say that they're just scared to go to any doctor, any medical building right now, but many doctors saying it is still important that you go get your chemo and get those treatments, as you just mentioned.
Right. Well, obviously you need to talk to your own physician and determine what the risk factors would be in that particular situation. So, for example, if you have those types of exams and screenings in a hospital setting, that would be very different than having them done in a freestanding facility where the risk of coming in contact with ill patients, whether it be COVID or other types of infections, would be much lower. So I would just really encourage people to talk to their own physician about risk.
Jill, I want to ask you quickly about the BreastLink Angels that you created. How important is it to have a strong support system around you during this time?
It is vital. Breast cancer is a diagnosis that I think is life-changing. And we have a group of approximately 60 women who have all had a breast cancer diagnosis. And we really are there to support newly diagnosed patients and patients as they go through their own process of treatment with breast cancer. And it really is a vital part of BreastLink in general. We work alongside the physicians, the different clinicians, and help their patients through it.
Yeah, well said. Jill Canales, thank you so much for joining us this morning, for your insight, for all your advice. Thank you.
Thank you.